if someone has cataracts and gets told that cataract surgery might be the best option, there are some frequently asked questions that one comes up with. And I've gotten to hear those a lot over the years because this is what I do as a cataract surgeon. So I thought it might be helpful to just answer in general, what are some of these frequently asked questions? So the first of these, and it probably comes up more than any other question, is the idea of recovery. So recovery from cataract surgery is shockingly easy. And I'm not saying that none of this is as a guy who's really just trying to get you to have cataract surgery. That choice is entirely personal about when you decide you want to move forward. That said, now that I've made that disclaimer, the recovery for this is something that is always really surprising for people on the good end of things. It's just not very common that the day after any surgical procedure that you're saying, I didn't feel anything and I didn't notice anything afterwards and we went out to dinner and celebrated my son's birthday. Or it's a much more normal evening. Now, with any sort of result, including recovery, there's going to be a bell curve to people where you have people that are on the exceptionally good and the exceptionally rough side of things. It just happens that like all of this bell curve all falls under stuff that's really, really, really easy. So this recovery is something that is, it's aided by the fact that it's a really minimally invasive thing that we are doing. I try not to talk about anything gross in any of my videos, but I'm going to use the word blood here only to say that there's no blood. And when you can do something bloodlessly, it makes recovery much, much, much easier. Everything that we're doing here is something that your body, we kind of sneak in and sneak out before your body's any the wiser. Now, is that oversimplifying it a little? Yeah, a little bit. But it is true that the recovery piece to this is basically the next day somebody comes in for their one-day post-op and we say everything looks good and we tell them that they can go to work the day after that. Most people feel like they could go to work the next day, but we want people to have an extra 24 hours of wiggle room just in case they feel like their eyes are getting tired. As far as swimming around and getting your eyes wet, we tell people to be cautious about that for a week and then after that it gets better and better. For makeup, a peek behind the scenes, we tell people 1 week before you can wear makeup again, but oftentimes if everything's looking good, then it's earlier than that too. So that's the story on recovery. The second frequently asked question, and I don't know if this one's number 1 or number 2, but it happens. Rather than writing out, does it hurt, we'll just write pain. People want to know, is there any pain with this procedure? The short answer is no, and I would tell you if there was, because it doesn't help someone to mislead them and then, haha, it hurts. That makes everything more difficult in surgery, post-surgery, all of that. There's genuinely no pain, and the reason for that is the same thing that makes your eye exquisitely sensitive to the slightest provocation, a tiny, tiny piece of dust that you cannot see, and if your friend can't see it when you're trying to show them and say, is there something in my eye, can feel like a boulder on the front of your eye. Because those corneal nerves on the front of your eye are so thin and unmyelinated and superficial, they're just naked tiny nerves on the front of your eye, it makes them really, really, really easy to annoy or cause pain. And it makes them really, really easy to numb with just drops. And so for the procedure, it's just drops. There's no needles. I try not to say needles ever either, but there's no injections. There's nothing like that. It's just drops, and it makes it so that you literally cannot feel any pain at all. Most people will feel either nothing for the first 2 hours after the procedure, or they'll feel like there's a slight irritation, like an eyelash in their eye, somewhere between those two extremes. And so there's genuinely no pain through the procedure. Pretty much every time I do this, it's just kind of chatting through it with somebody, and I'd say 1 out of 3, 1 out of 4 people just fall asleep midway through. So that's the story of does it hurt? No is the answer. And the final of these is glasses. And the question on this one is, How much will I need glasses, or will I need glasses? And the answer is, with refractive cataract surgery, the vast majority of people, we can get it to where they just don't need glasses at all. And that's for distance, that's the computer, that's near vision. Everything works, whether that's with multifocals, which is the minority of the time, or with blended vision, which is the majority of the time. You can get maximum distance in near vision. The question of whether or not glasses will be helpful in any specific in any specific situation, that's the word I was looking for, it's individual from person to person. So every now and then, and I don't have an exact stat on this, I would say it feels like 1 out of every 50 people or so, there'll be some specific situation where they'll want to have a specific type of vision for something, whether that's, it's hard to come up with examples because like people can knit without wearing glasses and people can drive at night without wearing glasses. But for something, can you get a pair of customized glasses? Yeah. Same thing with contacts. Some people really like their colored contacts and want to know if they can wear those after a procedure like this. Yeah. It's basically, after a couple of weeks, it's amazing how much it's kind of like nothing really happened in the first place. So there are possibly other questions that somebody might have, that you might have specifically, and those would be worthwhile to ask in clinic personally about your eyes. But these are the 3 main ones that people come up with, and hopefully that helps.